It has been touted by U.S. President Donald Trump and Brazil's Jair Bolsonaro as a potential cure for the coronavirus. But evidence has been mounting that anti-malarial drug hydroxychloroquine isn't effective and might even be dangerous. Now the UN's World Health Organization has paused its trial of the drug. It cited a major study published last week which found that hydroxychloroquine could lead to arrhythmias, that's abnormal heartbeats, and worsen COVID patient survival chances. The WHO had already expressed skepticism about hydroxychloroquine. Now it has announced it will stop its own trial of the drug while it further reviews the drug's safety.
We're just acting on an abundance of caution based on the recent results from other studies to ensure that we can continue safely with that arm of the trial.
Let's get some perspective on this story with Mohammed Munir. He's a virologist at Britain's Lancaster University. Mohammed, thanks for joining us. What does the clinical evidence say right now about using hydroxychloroquine to treat COVID-19?
I think the decision by the World Health Organization to pause the clinical trial and to take this hydroxychloroquine stigma forward is based on one large-scale study published last week on 96,000 people who've been treated with hydroxychloroquine in 675 different hospitals. So it's a massive study that collected the data from mid-December to mid-April. Based on this study, which was a retrospective study, which means that the data that been already existing, you take that and analyze. Based on that, two important considerations came up. One was that people who were treated with hydroxychloroquine, 25% of those died compared to 9% in untreated group. And secondly was that 8% of the people who were treated with hydroxychloroquine, they have arrhythmia, which is irregular heart beating, compared to 0.3% in non-treated. So all in all, this is really clear evidence that hydroxychloroquine is not only bad, but it has no efficacy against the coronavirus.
All right, so we're talking about some very real concerns here, Mohammed. Why do you think, then, that hydroxychloroquine has been presented as a possible treatment for COVID-19 by some, including the U.S. president?
Well, that is really important, and I think there should be some sort of accountability, because whenever people talk about any treatment without having any scientific data, that is a personal choice. And that is actually the reason in 6 continents this drug has been used lavishly without having any scientific evidences on its efficacy. So that is really concerning, and it would be extremely interesting to figure out how many people could have died because of using this drug, which is having no scientific backing.
Mohammed, if this drug is not safe, where does that leave us in terms of clinical research on COVID-19?
That's a very important question. I think if we're going to leave the hydroxychloroquine, that is not the end of the world. We have other drugs, those are being tested. One of them is remdesivir, which is having very positive outcome in the beginning, like 31% people were recovered very well. And the staying at the hospital can be reduced by 4 days, which is significant. So therefore, my suggestion from the beginning has been that we have to focus all our attention and the resources to test drugs like remdesivir, which have some hopes.
Mohammed Munir, virologist at Britain's Lancaster University. Thank you so much.
Pleasure to be here.
Let's check in now on some of today's other coronavirus developments. The German government is reportedly planning to lift a travel warning for tourists for 31 European countries starting mid-June. This will apply to all EU member states, as well as the UK and the 4 states of the borderless Schengen zone. That's Iceland, Norway, Switzerland, and Liechtenstein. Indonesia will deploy 340,000 security personnel to enforce social distancing measures. The country is preparing to reopen its economy. And Philippine President Rodrigo Duterte says he will not allow schools to reopen until a coronavirus vaccine is available. The country closed schools in March. Millions of children around the world are facing a surge in violence, forced labor, and underage marriage during the coronavirus crisis. That is a warning of the leading children's and aid organization, World Vision. In a new report, it estimates that lockdown measures, which were enacted to protect people, are actually putting vulnerable children at greater risk.
Schools out in Ivory Coast. This was March. Since then, hundreds of millions of boys and girls around the world have been in lockdown. no classrooms, no playgrounds, and nowhere to run. Now, charities are warning that the very measures meant to protect them could see them fall victim to violence. Like 12-year-old Kabita in Bangladesh, whose father is out of work.
Dad hits us if we ask for more food. He's frustrated and angry. It's hard to concentrate because I'm hungry. I have headaches and sometimes feel dizzy. Everything around me seems blurry.
Across Bangladesh, World Vision has been helping children whose family lives have been turned upside down by this virus. But these are unprecedented times.
This crisis is like nothing we've seen before, definitely. It exacerbated risks that were already there in most of the cases. For example, the child protection services or the protection that was provided by school are now being totally wiped out.
World Vision estimates that 85 million more children may be exposed to violence during quarantine. In Bangladesh, beatings by parents increased by 40%. An additional 4 million girls are at risk of being forced into marriages in the next 2 years. The UN says that spike is the result of families looking to recover financial losses. Frontline workers are concerned that failure to act now will lead to more trauma in the future.
I remember as a social worker having a case where 2 of the 7 brothers in an abusive family actually developed schizophrenia very early in their age as a result of the domestic violence and violence against themselves.
For months, the coronavirus crisis has been one of ambulances and intensive care wards. Now, experts say without extra funding and protection, it may give way to a crisis that is longer lasting and harder to heal.
Well, as we saw there, children in South Asia are particularly vulnerable in the face of abuse and violence during lockdowns. But that is true in many parts of the world, including right here in Europe, where countries like Spain and Italy have had a very strict lockdown measures. Let's speak about that with Aaron Greenberg. He's a Europe Regional Advisor for Child Protection with the UN Children's Fund, UNICEF, and he joins us from Geneva. Aaron, good to have you here on DW. If we look at the situation here in Europe during this current COVID-19 crisis, what is the main threat facing children here?
Well, I mean, certainly the confinement is a big threat because most of the channels that children would usually rely on to be detected or to report themselves problems at home are not available to them. We have to remember, I think, how high the levels of overall violence, and I'm talking about everything from hair pulling and ear pulling, psychological violence, all the way through to real severe forms of violence are in the general population pre-COVID. I mean, anywhere between 40 to 60% of all children experience some form of psychological or physical violence. So in that confinement period, where a lot of the basic services aren't available to children, and the stresses on the household are growing, we imagine indeed that violence will go up. And indeed, what we're seeing is that largely it has.
Aaron, you mentioned there are some of these usual channels that children may have to report abuse, be it schools or social networks, are not available right now. So how do you detect cases of abuse, of violence?
Yeah, I mean, this is where governments have to make really important decisions on what they consider essential services in these critical times. Certainly, the most widespread way is through helplines. In the UK, the National Domestic Abuse Helpline increased to 25%. Over the course of the confinement. In Spain, as you mentioned, 20% increases in calls to national hotlines in the last 2 weeks in March. In France, 32% increases and 36% increase in the area of Paris to the police prefecture. And in Denmark, for emergency accommodation, the requests for that almost doubled in the weeks after the confinement. So it's really important to see that this isn't, and the clip that you played as we came into this discussion about Bangladesh is really important. Let's not forget that that this is also true everywhere in the world, including in countries like Europe. One of the things, since we're talking with the Netherlands at the moment, and this is a Netherlands-based news network, is that really important programs of home visiting nurses, which you've got the National Nurse Family Partnership in the Netherlands, which has been picked up by many other countries, has reduced child maltreatment by a large percentage in the countries in which it's implemented. It relies on face-to-face interaction with families, and when you don't have that, it's very, very challenging to pick up the signs of abuse and maltreatment.
Aaron, just very quickly, what is your message to governments here in Europe? The most important thing they can do going forward to make sure children are protected?
Yeah, three things. One is essential services, making sure that when they're defining essential services during periods of lockdown, that mental health services and some of that face-to-face services on the back end of reporting, so that if you do call and it really is clear that you need a home visit, that the protective equipment is available to social workers and police officers to make that supportive home visit. The second is really making sure that some of that family outreach continues, even through Zoom. Some of that important interaction that the nurses are doing with families continues, especially with highly vulnerable families. And the third is to really have national conversations and local conversations about violence. We don't want to pull every child out of a family if they're being spanked or they're having their hair pulled, but we do need to have people aware about the consequences of that behavior on children over the medium and long term.
All right, Aaron Greenberg from UNICEF Europe, thank you so much for joining us.
Thank you.
The U.S. has pushed forward a travel ban on Brazil by 2 days, meaning it will come into force on Wednesday. Well, the travel ban is being seen as a blow to right-wing Brazilian President Jair Bolsonaro, who has been downplaying the virus and pushing for lockdown measures to be lifted. But the pandemic is gaining speed in South America's largest country. Brazil's most recent single-day death toll overtook that of the U.S., with 807 deaths compared to 620 in the U.S. Brazil is now the country with the second highest number of cases globally, more than 370,000. That is still significantly fewer than the U.S., which has more than 1.6 million cases. Deaths from COVID-19 in Brazil number more than 23,000. In the U.S., the death toll is approaching 100,000. Well, before Washington announced its travel ban, some Latin American countries imposed restrictions that have already left hundreds of people stranded.
Grounded by fear, would-be travellers at Rio's international airport can't go back to Colombia. Their government is scared they'd bring the coronavirus with them, so they're stuck. Now the US is bringing in a similar ban. Passengers and planes going nowhere. The world has been spooked by Brazil's rocketing coronavirus infections.
In many countries, it has shown that after a certain number of cases, after a certain threshold, it moves like a bushfire, exponential. It did it in China, in Wuhan. It did it in many European countries. And it's doing it now in, as you said, in Brazil. It really moves fast. That's why we need to do everything to slow it. And the slowing is mainly in the social measures, social distancing measures that we take. And they have to be as really aggressive as possible.
That aggression against infection is patchy in Brazil. This beach, just half an hour's drive from Rio, is open. Some shops are too. People are out and about. Locals can see a way out of the frustrating lockdown. I think that the conditions are in place for it all to turn out well. It's not possible to free up too many things. I think that the way it's being done is correct, and with hope that all this passes and we can return to normal. In Rio itself, most things are still closed, but the city's mayor is under pressure to produce a timetable for reopening. I'm not saying that shops are going to open tomorrow or the day after. It'll remain to be seen. But they're demanding a plan, and that's what we need to give you, some encouragement, a horizon. President Jair Bolsonaro continues to offer encouragement and even handshakes to his anti-lockdown supporters. Outside the presidential palace in the capital, Brasilia, he again ignored distancing recommendations and shouts from opponents calling him a killer.
The German government is throwing a €9 billion lifeline to the country's national carrier Lufthansa. The airline has been locked in talks for weeks with Berlin, seeking a bailout to survive the coronavirus travel slump. If the deal goes through, it will be the largest German corporate rescue since the crisis struck.
Lufthansa planes have been idling on Frankfurt's northwest runway for weeks. The government has been debating for nearly as long about how to save the company. Finally, a breakthrough. The government has reached a preliminary deal with Lufthansa on a €9 billion bailout. This is about maintaining Germany's global leadership in civil aviation, and it's about ensuring the future of a healthy and traditional company that is experiencing a tough time because of the coronavirus pandemic. The aid package involves the German government taking an initial 20% stake, which it plans to sell by the end of 2023. This stake could rise to a blocking minority of 25% plus one share in the event of a hostile takeover. If the state spends this much money to support a company, it has an obligation to ensure that this investment does not come at taxpayers' expense. For Lufthansa, the deal means no bonuses for management, no payouts to shareholders, and no money squirreled away in tax havens. Despite these conditions, the board expressed its gratitude to the federal government. Trade unions, on the other hand, are disappointed. Unfortunately, the fact is that the deal does not include guarantees of job security. It's a real shame. You can't just give money to a company like this and not say they need to keep jobs instead of cutting them. The Greens party also believes that the deal should have contained more measures on climate protection. Lufthansa's commitment to renewing its fleet would hardly contribute to cutting CO2 emissions.